Good afternoon, everyone, and welcome to part 2 of a community of practice on homelessness session entitled Addressing Racial Disparities in Healthcare Amid Emergencies and Disasters. I draw your attention to poll number 1. Is your organization led by a white president, CEO, or executive director? And those responses are coming in about close to 3/4 yes. Poll will be closing soon, so please answer that. Let's talk about a few housekeeping measures before we begin. For those of you that are social media inclined, we have a hashtag HCHMD community. And our handle is @HCH homeless. Hashtag HCHMD community and HCH homeless. There's the poll results there. 73% of you respond that your organization is led by a white president, CEO, or executive director. And most participants here, I would gather, are indeed in the human services space. Live polls like this one will be launched throughout the session. They are completely anonymous. We cannot track the answers. I ask you to please participate in them and take them quickly because they will go away, but they will provide useful information to help direct our discussion. Some context from session 1. 2 weeks ago, more than 170 people gathered to discuss 3 overlapping public health emergencies: the persistence of poverty and homelessness, COVID-19 and the disproportionate rates of death among Black and brown people, and the institutional, individual, structural racism, itself a public health emergency that is painfully evident both in homelessness and in COVID-19, not to mention in the repeated phenomenon of Black and brown people dying at the hands of police and white assailants. In our first conversation, we were joined by Baltimore County Executive Johnny Olszewski, Dr. Lisa Cooper, and the Reverend Dr. Todd Yeary to begin a discussion of racism and the changes that need to result and take place in racist practices, systems, and policies in order to attend to the health of our region. Now, where do we go from here at this intersection of homelessness, racial inequities, and healthcare disparities? We've got some changes to our approach this time from 2 weeks ago, and many of these changes are in direct response to your feedback. This is a community of practice. It is not a webinar. And so we're going to conduct this particular session more like a fireside chat, where I will be participating actively in these conversations with our panelists and encourage all of you observing to participate in them as well. In order to facilitate that, we are not holding all questions to the end. So I encourage you, I will prompt you at the right time to direct questions to the Q&A box at the bottom of your screen, not to the chat box. You may use the chat box. It provides wonderful interaction for participants, but please direct questions for participants to Q&A. And then, again, as I mentioned before, we will have repeated polls that you'll be able to take. So let's move right now to an introduction of our fireside chat participants. We are joined by the Reverend Dr. Todd Yeary, back again for this second discussion. He is Senior Pastor of Douglas Memorial Community Church and Senior Vice President and Chief of Global Policy for the Rainbow Push Coalition. Welcome, Dr. Yeary. We are also joined by Randi Woods, Senior Director of Community Care Coordination for the wonderful organization Sisters Together and Reaching, also known as STAR. And we're happy to be joined by the Honorable Calvin Ball, Howard County Executive. Welcome. We're going to be addressing a different topic with each participant, and people will have between 5 and 7 minutes for the exchange, and ask that you incorporate personal information about yourself as you answer the question that we're discussing. So let's begin our conversation with Dr. Yeary. Reverend Yeary, in our last conversation, both you and Dr. Cooper stated that in order to go forward, we need to know and be students of history. You referenced the Kerner Commission report of 1968. I'd like us to go back even further to 1852, to Frederick Douglass's landmark speech, "What to the Slave is the 4th of July." The anniversary, 168th year anniversary of that speech was Sunday, where his statue was taken down. I'd much rather talk about statutes than statues, so we won't go down that road, but that action was a fundamentally different action, serving a different message than the message communicated by other statues coming down, particularly of segregationists and Confederate leaders. But those disparities that Frederick Douglass discusses parallel those of today, 170 years later. Will you discuss those parallels?
Well, first, Kevin, good afternoon to you, my friend and colleague, and a tremendous work, and to all of your team that continue to put together these important conversations and commitments to doing some very important work. Thank you for allowing me to come back a second time. Sometimes that's a special honor. Very often I get one time and then it's kind of one and done. And certainly good afternoon to your other panelists as well. So 1852 is an interesting time for Frederick Douglass to raise the issue of the contrast and the meaning of the 4th of July. One of the things that he points out in his speech after he addresses his nervousness and the awkwardness of being included in this conversation, recognizing that the status of many like himself precludes a full celebration of the 4th of July. The 4th of July is a celebration of the establishment of what we would call citizenship and personhood. We hold these truths to be self-evident, that all men, in brackets, right, are created equal, that there's a certain entitlement tied to the acknowledgement of humanity, but that acknowledgement was not then, and I would argue is not now, universal. Because what we have seen is the denial of common humanity played out on camera in the death of George Floyd, played out without camera in the death of Breonna Taylor, played out on camera, Ahmaud Arbery, Rayshard Brooks, you know, the list goes on and on and on the policing side. And then so many others who are nameless, very often faceless, and denied even the common dignity of acknowledgement and recognition as people, who often find themselves by their situation as what we would call homeless. There's an awkwardness that says we celebrate the affirmation of common humanity and citizenship, but the rights that we assume go with those two things are missing. And so Frederick Douglass raises then, and I think as we look at his speech even today, raises now, that there's still an unresolved contradiction. That's what the Kerner Commission lays out. That's what we see throughout various periods in our history, is that we've still not resolved the quintessential and fundamental issue of, does this notion of equality, liberty, and justice for all really apply? Or do we still have this celebration for some and observation for most, because we've not wrestled with the fundamental questions of the acknowledgement of personhood and citizen, human citizen, national citizen at the same time. So I think it's important that we raise it and we continue to wrestle with it so that ultimately we can resolve it in real time.
Yes, and I heard repeatedly as we approached the 4th of July holiday, which was recognized last Friday on the 3rd, staff within our own organization saying, look, this doesn't feel like a holiday to me. I recognize that it's a national holiday. Why does the agency have to recognize this particular holiday? Could we recognize a different one? What hope do you think lies in changing these disparities now, if we haven't done so already?
Well, you know, there is an adage that says you never waste a good crisis.
I like that saying.
Right, we're in the midst of a crisis. If we ever needed a great justification for doing the transformative work of justice, that moment is now. It's in this season, not to be put off for another generation or another season. And we can't go back and just bemoan the fact that others before us did not deal with it. The window of opportunity is now, and only those of good faith and goodwill who are willing to wrestle with tough questions are going to be able to make the kind of impact that we want to see under the current circumstances.
Yes, and we're coming up now on the 5-year, we're at the 5-year anniversary of the death of Freddie Gray. And so what does this mean within that context, especially for our poorest populations? You mentioned earlier people experiencing homelessness.
Well, it means so much, right? We look at 5 years. Imagine that 5 years ago, what was on the minds of America when Freddie Gray died, well, before that was Michael Brown. There were spaces in terms of the violent reminders of the lack of common humanity. Now we have this convergence of all of these concurrent issues simultaneously, and still we're dealing with the structural issues. You see corporations running, I call it, you know, they're trying to buy some salvation from corporate hell, because many of them have exploited some of those same circumstances for a bottom line. And now they're confronted with the fact that everybody's looking at profitability without the absence, or with the absence, of corporate social responsibility. So I think what we have to do is we have to look at these structures that leave folks on the margins intentionally, that's by design, and figure out how do we address issues like livable wages. We've had those conversations. It's not just minimum wage when you have to work 2.5 full-time jobs to be able to support one adult, one child in Maryland. That's a problem. That there's something violent about that in a way that other violence does not represent. When we exact the violence of insignificance and inhumanity, it cuts to the core of the decency and the fabric of a society. And so we've got to deal with those issues and say, not what will I lose if I advance justice? What will I lose if I don't? At the end of the day, the credibility and the reputation of a society is tied to how it treats the least of these.
Yes, indeed. And this notion that leaving people on the margins of society, as you mentioned, is intentional, is very much one that is often present in our work. For 35 years, we have worked to prevent and end homelessness, and yet we are simultaneously participating in broader systems that create and perpetuate it. And so that very charge that you provide is a charge to all of us in the human services space. Thank you, Dr. Yeary. And as I turn to Ms. Woods, let's take a quick poll. Bring participants into this. Ross is behind the scenes doing this, so we'll give much appreciation to Ross. I have the power and influence to address racial inequities in my organization or institution. Strongly agree, slightly agree, slightly disagree, or strongly disagree. Pretty divided here on the agree and disagree. The slightly agree has the slight edge, which perhaps gives us a little bit of hope. It's a good place to start. So Randi Woods, hello.
How are you?
I would like to stay on the theme of history. In his landmark speech and book, Where Do We Go From Here? Chaos or Community, Dr. Martin Luther King Jr. states that one of the many causes of racial inequities is powerlessness for distressed communities of color. Renowned family therapist Dr. Kenneth Hardy, and there are resources that are being shared for you here in the chat box. He relates this powerlessness to voicelessness. Two of the biggest words that I've heard from our clients, particularly those living on the streets and in shelter. As a community health leader, will you help us to understand the concepts of voicelessness and powerlessness?
So thanks, Kevin. And as I've been going on with this question, I think as a nurturer and a person that has created space for persons over the last 20 years, I think I would lead into this conversation to say it is emotionally bruising to be without voice. And so as you had done that poll, I would ask further persons that had taken that poll, how much do they feel like their voice, the things that they have said in their organizations are actually taken and listened to? And so when we're talking about this concept of voicelessness and powerlessness, voicelessness is a kind of powerlessness, right? Powerlessness is the inability to have influence over a situation. It's usually the imbalance of power. And let me ask, is my connection going in and out? I want to make sure that I'm clear.
No, you're coming through loud and clear.
Fantastic. And as I was saying, like voicelessness, it can encompass actually using one's voice to speak out, right? So voicelessness can be in the absence of, or the silence of, or actually it can actually denote that you did articulate something, but persons in the room chose not to hear it. And so when you say, I chose not to hear you, what you are saying in essence, what we say, because communication is verbal and nonverbal, that action says that I don't see you, I don't recognize you, and so therefore you have the inability to have influence, and influence is having power. So as Dr. King was talking about in his speech, where do we go from here? He says, like halfway down the middle, he says, from the old plantations of the South to the newer ghettos of the North, the Negro has been confined to a life of voicelessness and powerlessness. Stripped of the right to make decisions concerning his life destiny, he has been brought to the authoritarian and sometimes whimsical decisions of the white power structure. In that, I think Dr. King is talking about in the absence of having Black and brown folk at the table, in the silence of our voices. But today, when we're talking about creating spaces for these uncomfortable conversations, I think we're talking about persons are making their voice heard, but we have to ask ourselves, those persons who are holding positions of power in organizations, in deans of universities, in health institutions,
CEOs of nonprofit organizations.
Nonprofit organizations. We have to say, how are we creating space and how are we showing up, right, to sit at the table and hear things that make us feel uncomfortable? And sometimes it's in the uncomfort that we choose not to hear what people say. So we choose not to take what they say. And so therefore, in our actions, we say to them, you are powerless. Having sat at the bedside with persons who are unable to speak because they've had a surgery that has, taken away their voice, I've had to reflect on how did I show up in that situation, right? And usually times it was easy for me to take what I could understand and I felt confident in doing. But when I couldn't make out what they were saying or I didn't understand it, I procrastinated on it. And so a lot of times in these places and spaces, we procrastinate on ideas because they make us feel uncomfortable. They make us feel vulnerable. And in our vulnerability, it questions our power. right? Because in power, it says that I know all things, I'm an expert in all things. And that place, we have to talk about vulnerability in this and what that, what that really denotes to the public. But when we talk about voicelessness and powerlessness, it is because when we don't hear people, not that they are not making, valued input, when we choose not to hear people and take their opinions, what are we actually, what does that say back to them? And I suggest that it says that I don't see you and therefore you have no influence, but you were called to the table. Yep. So it could be diverse and inclusive, but I have, I can choose to take what I want and go along my merry way. And I think that that is some of what we have to deal with, to say, how am I showing up and creating space?
I find myself really resonating with that question that you ask of how do I show up? Eddie Martin, our director of engagement, who is behind the creation of this community of practice, often asks publicly, what is my space and place in the dynamics of race? And it at first it's a cool saying that rhymes, and after that sinks in a while, it's something, how am I as a white CEO inadvertently silencing voices, as you mentioned? I love that you pointed to that poll and really wanting to go deeper. Where is it that people have voices, and then how often are those voices either deliberately or very subtly silenced? Can you explain a bit briefly how institutions and communities can create platforms so that voices of Black, Indigenous, people of color can be heard and can access power?
I think when we talk about creating platforms, and I think that platforms have been created. What I don't always say is how we create platforms for voices to be heard, and we take the narratives of persons. We can see that in our community advisory boards and, our, community meetings where we're trying to get insight. But when what happens on the next step? Do we include those persons who were at the table to share their lived experiences and to share their narratives? Do we say that you are just as important and just as the expert, that you should be a part of the process to even develop the program and see it through? And so I think that when we're talking about that, to say, how are we creating programs that are inclusive? And that means getting away from status quo. It does mean that it may feel a little differently to say there are other experts at the table that, and they're not given evidence-based, research. They're given lived-based experience, and that needs to be taken into consideration. So when we talk about creating platforms, I think we're creating the spaces. I like to call platforms spaces. We're creating the spaces, but it is how do we follow through with those spaces and those persons who show up at the table? And so it's really, it goes back to, can we get uncomfortable with being vulnerable and leveraging or balancing the power, right? So when persons come in, when we create platforms, are we telling community that everyone in this room is an expert, and because you are an expert, I'm going to need your expertise until we get to the end, not just at the beginning and then I come and tell you what we created, because that sends the message, oh, your lived experience, that was great, but you don't have enough expertise to develop programs.
Yeah. Thank you, Ms. Woods. I want to turn now to County Executive Calvin Ball. Thank you for being with us here today, sir. And as I think about you and me together here on this panel, we are two individuals in positions of power with very different demographic circumstances. I find it very important in this particular climate to more often than not state the obvious. I'm a white male CEO of a nonprofit organization. The people I serve are among the poorest individuals in our society, and they are predominantly Black. You are a Black male in an affluent majority white county. Can you tell us about your unique experiences being a Black male in such a powerful position in that context?
Well, first of all, good afternoon, and thank you, Kevin, and everyone who helped put this together. I appreciate it. I'm honored to be here with my other esteemed panelists, and thank you, everyone, for taking the time, because you could be doing anything with your time, but you're investing not only in our todays, but our tomorrows to make things better for everyone. I think back to the day after I won my election. And after a hard-fought race of going into campaign headquarters every day, that muscle memory got me up and I went to campaign headquarters. And of course, no one was there when I got there, and I just looked around, and then someone came, and it was an older white male. And he asked me, "Did you win?" And I said, "Yes, I won." He said, "Well, you know, I am one of your volunteers and I've been coming every day, but I didn't really think that you would win." And I thought back to when I began my campaign, and so many people said that in Howard County, where about 80% of the people were non-Black, it was impossible for a Black man to win county executive. And to me, being able to win, especially with so many votes, gave me the power to make sure that I fought for all Howard County residents, so that we weren't just a great county overall, we were a great county for all. And that meant working on the hard work, such as looking at the real issues around homelessness, whether it is addressing the opioid or addiction challenges, the mental health difficulties, the financial or economic challenges, and saying that in Howard County, according to our last homelessness count, we have about 2,100 people who are homeless. And so in many other jurisdictions, that's a small amount. But to me, that means that we have an even greater duty to not just make incremental change, but work to eliminate homelessness in Howard County. A place where, although we are seeing a rise in our opioid and addiction challenges during COVID-19, we actually started seeing a fall. So we can make sure that people have the substance misuse services that they need. A place where, while we are affluent, when you disaggregate the data, you see differences when it comes to people of color, people who have disabilities, people who might not have even been taught some of the fundamentals of financial literacy and haven't had access to those grants and contracts, dismantling those barriers to make it so that more women-owned company, disabled-owned companies owned by people of color have those challenges. And I see that as a great responsibility.
What are the particular challenges of leading efforts to address racial disparities in the county?
Well, I think when I walk the line, of course, there are those, and we see them, who don't see color, and they think that this is something positive, but really what that shows is that they either don't recognize that we see what is around us and the truth of what is around us, or they choose to negate the Blackness or brownness of those around them. And they choose or just don't see that there are challenges or problems. There are people who don't recognize their inherent discrimination. Mm-hmm. And of course, right now we're talking about race, but as you noted, we're two men who are in positions of power. So when I hear from women who say that there is sexism, it's not up to me to say, no, there isn't. Just like it's not up to anyone who is not a person of color to say, no, there isn't racism. Mm-hmm. And navigating that while still seeing that there are going to be those who have sometimes what feels like unrealistic expectations of what can be done in a period of time, Conversely, those who think that nothing can be done and have lost hope. And so walking the line of the intersection of all of those issues and challenges and moving a county, a state, and a nation forward is an opportunity.
Yes, and a particular challenge. And I think I've got a challenge within one organization. My goodness, the challenges that you are navigating across the county and the state. We come now to our first question. Let's follow this up generally, and maybe we'll go right back to you, County Executive. Can you speak to the role of Black leaders who may be the first person of color in that role? How do we work to change the culture of organizations that have longstanding practices that didn't support people of color having a voice, even when they were the majority of that institution?
I think we need to look at the past, the present, and the future. When I talk about looking at the past, seeing who's around us, one of the first things that I did was I tried to make sure that my leadership team reflected those who we serve throughout the county and the state. And so my team is diverse, people of all colors and backgrounds. So much so I remember when I first had them in, there were some people who would actually put on my social media, "Why are you only hiring just Black people?" And so that is looking at the past, and then looking at the present and saying, what can we do to expand opportunity for all? For example, me talking with our purchasing and procurement entities and saying, let's disaggregate these data and see who is getting access to contracts and grants and opportunities, and then looking toward the future, mentoring the emerging leaders of color and saying, here's how you can become better. Here's how you can not only assemble power, but effectively wield power to make things better for others.
Excellent, excellent. Thank you very much. Either you, Randi Woods, or you, Dr. Yeary, care to answer that one?
I would like to offer a resource in terms of when we're talking about culture change at an organization and things that can be done now, especially understanding possibly persons in service organizations. And it's a game called Factuality by Natalie Gilliard. And it gives persons an opportunity, because when we're talking about culture change, we need to be talking a lot about self-reflection. And through this gaming 90-minute game, Natalie has had great influence in allowing persons to come and come in contact with their own biases, their own microaggressions, and things like that. And so changing culture, I think we need to say, how do we give persons the opportunity to begin to bump into themselves and to have a space to explore that as an organization? And so that's one, that would be one tool I would actually suggest as a person is trying to change culture.
Thank you, thank you. Before we move on to the next question, we've got 2 polls. So let's launch poll number 1. I am aware of my blind spots that perpetuate interpersonal and institutional racism. See how this one goes here. There we've got about a quarter strongly agreeing, more than half slightly agreeing, and close to 20% either slightly or strongly disagreeing. Let's launch the second poll, or now the third. Actually the fourth. Here we go. I am aware of the specific ways that racism, interpersonal and institutional, operates within my organization or institution. Right, again, with slightly agreeing here, having the majority about 42%, 31% slightly disagreeing, only 7% strongly disagreeing. Ms. Woods, let's move back to you. We continue to see Black people killed at the hands of white police. And we know that there's a need at the very least to reform policing. And yet we also know that the problem runs so much deeper than policing. When we think about the need for systemic change, we do not often attribute the problems to our predominantly white-led, progressive, liberal human service institutions and organizations. We talked about this generally early in the conversation. Let's go there a little more specifically. Dr. Robin DiAngelo, a white anti-racist scholar, believes that, I was just reading this recently, quote, white progressives cause the most daily damage to people of color. Wow. Why would she say this? She defines white progressives as anyone who thinks they are not racist, or are less racist, or are in the choir, or already get it. I hear in these words the same kind of defensiveness that I must acknowledge at times I have felt, particularly over the last month. I have to acknowledge that I have heard from those in my organization, particularly from white leaders within the organization. Hey, what do you mean we're acknowledging that we're part of the problem? We're the good guys, right? Very much reflective of what Robin DiAngelo here is talking about. From your perspective, how do you see our white-led progressive and liberal human service institutions and organizations perpetuating racial inequities?
Kevin, I would, if we could take a poll to say who on the call identifies as white and who on the call identifies as Black, and then go back to those polls, right, that said slightly, you know, I am aware of my own blind spots. And the majority said, I am aware of my own blind spots. And then the other one was, I am aware of the racism in my institution. And I would probably say, I beg to differ. Being at tables where we have come together and we're supposed to be an alliance with a liberal social organization, human services organization. And when we get to the table, voices are silenced in the way of, yes, we are brought to the table to express our opinion and to give our expertise on the community. Working in a legacy organization, working with my mother that has had this organization for 30 years and witnessing her be at the tables, right? And because of how she is strongly expressing her opinion, doors have been shut. There have been microaggressions. There have been niceties across the table. Oh, great meeting. We look forward to continuing to have this collaboration. But then they go back into their ivory towers and do just the opposite of what we have expressed at the tables. And so this is, it was great that you extended the offer to come and once again, and make your table inclusive and diverse. But what a shame that your actions said to me that it's only your presence, but not so much your voice. So we don't want you to have that much influence. But please be there to help us tell our narrative of how we are now, you know, partnering with the organization. And so it is blind spots like that. And I have to say that sometimes we don't see it, persons don't see it because they do have a love for STAR, they have a love for Reverend Hickman, they have a love for the community health workers that make up STAR. But as Dr. King even said, and where do we go? He says that love without power is kind of sentimental and anemic. And so your love for us and your admiration of us without instilling power, therefore, to get to a purpose, is kind of, it doesn't say anything, it doesn't do anything. And so once again, when we're creating these spaces and places, we have to ask ourselves, and institutions and persons that make up institutions and systems have to ask yourself, how are you showing up at the table and willing to get uncomfortable to begin deconstructing what is not working?
And
right?
how are you sharing power?
And how are you sharing power? And how do we begin to balance that power? And so I think that we don't realize sometimes that we are in institutions, and behind that person's, and I think when we talk about professional and personal, right? People have to come to terms with saying, my professionalism or my accolades do not give me power over someone else, or over another organization, and they can be the experts as well. But I think those are the types of like provocative conversations that you have to have, and to say, we're not going to continue to come to the table to have these nice conversations and we're not getting to change.
I think that's one thing that we've all probably, some of us have learned for a long time, some only more recently, that it's a real privilege to separate the personal from the professional, right? It's a privilege to even be able to do that. The subtitle of this session is the recovery, addressing racial disparities in the recovery stages of COVID-19. I would argue that we are not really pursuing recovery. That should not be the goal. Recovery is about getting back to your former state and glory, if you will, right? To your full strength. We're really talking about something else. And so what must these institutions do, and their leaders like me, do to eliminate racial inequities in these recovery stages, or this catapulting to something else?
I'm going to say take ownership and accountability. So often we can hide behind systems and we can hide behind institutions. And I think that it is people that make up those institutions. And so we have to begin to hold ourselves to that and to do the self-work. And the self-work is things that we don't talk about in these spaces. We always talk about helping other people because we are in the business of service, and but the first person that we need to help is ourselves, because I can't help other people to bump into their brilliance or bump into their power unless I myself have been able to bump into my own brilliance and bump into my own power and continuously, daily do this work. And I think we need to make space to say that this is not going to happen overnight, right? That this is a journey, this is a marathon, this is not a sprint. There are going to be loads of uncomfortable conversations. There are going to be loads of meetings where we don't agree. And we still have to continue to stumble forward. And it's okay to stumble forward and to call out when we are trying to be perfect and say that perfect is the baby of oppression. And so when we begin to call out all of these microaggressions of, and I keep coming back to STAR, because when we work with larger institutions, they put demands on us, right? We need this by this time. We need this by, well, we don't have that bandwidth. And so when you do that, once again, you are saying you don't understand me, you don't see me. And then once again, really, do we have a balancing and an understanding of everyone in the room? And that gets back down to power.
Perfect is the baby of oppression. I had to write that one down. Earlier, you brought your mother, Reverend Deborah Hickman, into the conversation. She's observing us. And as she writes, my observation is people who believe they are powerful are really powerless. They come saying they want to see change, but in reality, they have not weighed in on their own biases. How do we hold these leaders accountable?
Yeah.
Wow.
We've had conversations.
Two generations of powerful women. Yes, I was going to say Hickman, but Hickman and a Woods.
Still generations of the Hickmans. It has been, it has definitely been, when we talk about legacy, the legacy not in terms just of wealth, but of branding and how we show up as a community. And I think when I talk about my mother, this has been a place that has been, even for us, when we go through, we are challenging each other to show up better. And we have to say, well, where are your blind spots? Because how are you showing up at the table, and how do we create space for our employees? And how do we tell them that as community health workers, you are powerful, you can make change. But then how do we show that in our actions, right? To make sure that we are creating space where they can not only use their voices, but we in leadership positions, we go along with what they suggest, even if it makes us feel uncomfortable. Just because we're not used to it doesn't mean it's not right, because that is where we can have some innovation. And, you know, as we're talking about innovation and things and saying, where do we go from here? Understanding that innovation is going to make all of us feel uncomfortable, because none of us will be the experts on how to move forward. Right. We just have to trust the process and work together.
And if by definition we cannot see our own blind spots, we have to put ourselves in situations where we're willing to ask others to point them out, and to make others be in a comfortable place where they can point them out and not get defensive and shut down when they are.
Yeah.
Thank you, Ms. Woods. County Executive Ball, let's bring you back into the conversation. In the wake of the deaths of Black men and women, we've heard a lot of calls to defund the police. We also hear anti-racist scholars regularly discuss the need to dismantle or deconstruct the system. The system that produces everything that we are experiencing. When these words are spoken, it often makes individuals, especially and specifically white individuals, feel uncomfortable and get defensive. Will you share with us your perspective about the nature of this discomfort?
So I think that when there are people or systems that have a great deal of power, especially if they've never truly felt powerless, they don't want to give up that power. And so they will fight against it. I also think that words matter. And when we are trying to make progress uphill, we need to be very careful with our language. And I think that, for example, in a place like Howard County, when people hear defund the police and they see, well, nearly 60% of the budget goes to education-related services, and about 12% goes to police. What does that really mean in Howard County? And then the conversation spirals sometimes downward as opposed to moving us forward. You know, I recognize that while anger and frustration may be sustained, it is less frequently that actionable anger and frustration is sustained over time to ensure that there is progress. And so when we move forward with not only recognizing those systems of power will defend themselves, recognizing that using language that helps us progress is more productive, and seeing what the real facts are on the ground, and then setting objectives and goals that help truly make lives better for all, then we'll see that type of progress.
Let's go back to those phrases, because those words are used, of defund the police, deconstruct the system. What do those mean to you, and why do you think such actions are either necessary or deemed necessary by those who say them in the quest to achieve racial equity, especially in these recovery stages that we're talking about?
So in sometimes argumentation, you hear the phrase, when you're explaining, you're losing. And when you have people who have to go on TV and explain what defund the police means, I think we're losing the air and the argument, especially given that most people don't have the same focus and attention on issues. So when I hear things like defund the police and dismantle or deconstruct the system, I understand where that frustration comes from. I understand people recognizing that important human services have been insufficiently funded oftentimes for generations. And I see that we need to do significantly more to ensure that there is that funding that helps address the real quality of life needs and helps democratize the system that we have. However, I think that when you look at what does that really mean? Does that really mean ensuring that when it comes to a community college system, people get scholarships so they can pay for bus passes and books? I think that is something that's more actionable, something that's substantive and helps people move things forward. When we talk about, are there residential treatment centers, making sure there's money for a residential treatment center to help people with substance misuse disorders, financial literacy, helping to grow entrepreneurs so that people aren't just being unemployed or underemployed, dreaming about what can be. These are the substantive things that can be addressed, that sometimes phrases like defund the police, when we have to explain them for too much, I think detracts from our true goal, our shared goal.
I would add affordable housing to your
Yeah.
list. Yes.
And a full spectrum of housing affordability, so that we not only address things like we see gentrification in certain neighborhoods, but that we see people getting that entire spectrum. Oftentimes, people will start off in the apartment and then maybe move to the attached home and then to the semi-detached home and then the detached home. But sometimes in those latter stages, people stay and they don't leave. And so in some neighborhoods, you see people for 30 or 40 years staying in a detached home. And then people who might have started off in that apartment, saved up their money, got their credit straight, there's no place for them to go. And so ensuring that there is a place for a full spectrum of housing affordability and home ownership where people can begin to build and grow wealth for future generations is something that we need to fight for each and every day.
Absolutely. Thank you. Thank you, Dr. Ball. Very much appreciated. And as I turn to Dr. Yeary, let's take our final poll. I understand what it means and takes to be an authentic ally. I understand what it means and takes to be an authentic ally. Randi, I like your focus on data. I can see you paying attention to each of these polls. What is this telling us? And there we are again, about 45% in the slightly agree category. So the majority slightly agreeing or agreeing, and the minority disagreeing, or a very small percentage here strongly disagreeing. All right. Wow. And I would say that your reaction previously, Randi, to the previous polls, all right, is this really the case that the majority understands what it is to be an authentic ally? I think we should have some conversation about this. Before the question, I invite you to direct your questions to the question and answer box down at the bottom of your screen. If you've not already, for our upcoming Q&A session. But to Reverend Yeary, in our first session, you stated, this one stayed with me. It's like the phrase, never waste a good crisis, but you said that windows such as these to address racial inequity are often short, too short. The window is open, it's going to close. Will you tell us about how racism has become sensationalized and what is at stake when sensationalism is over? It's being talked about on Instagram. Let's discuss, let's start with that. Tell us about that.
Wow, where do you start with that is really the question. Let me kind of frame the notion of the sensationalism of racism in the age of social media. The nation is shocked because of what the nation can no longer deny. There's a book called Without Sanctuary. It is a publication of printed photos of lynchings. lynchings where crowds who had been to church in the morning grabbed lunch sacks and went to the public execution, very often of a Black man, and took pictures with the body still hanging from the tree. Several weeks ago, we saw now another public lynching, 8 minutes and 46 seconds of a police officer's knee on the neck of George Floyd, who they encountered simply because George Floyd was suspicious of passing a $20 bill that we've still not seen. So the sensationalism is we have these moments where these kind of rare public examples that cannot be denied literally scare the hell out of well-meaning white people and make them want to talk until they can finally sleep again at night and pretend that things have kind of gone back to normal. And so one of the things that we haven't really kind of talked to, Randi's more polished than I am. My sister's good at it. Reverend Deborah Hickman, who's been a mentor and a mother to many of us. I went to school with Dante. So we've been around each other for a while, Calvin Ballfriend. One of the things we haven't talked about is we treat tokenism like it's progress. So your earlier question about the question in the chat about those who are the first, the reason there's so much of a burden is we use the process of selection as an excuse not to do the work. And then we handicap the first time token leader that allows us to check the box to say, ooh, aren't we progressive? Well, if we're progressive, show me the progress. A progressive oppressor is still an oppressor. And so we gotta deal with the sensationalism of this kind of, to Randi's question. We see the numbers, but for those of us who look at where the data comes from, we would push a little bit to say, okay, where is your risk? Because if all we're doing is waiting for this dust to settle, where we get another maybe extended period, where we don't have this convergence of issues in our face, that this will allow us to say, whew, we weathered that one again and nothing changes. It goes back to your first question. Frederick Douglass could make that speech for the first time today because we've made tokenism the excuse for true progress. We became post-racial with the election of Barack Obama. Nothing had been put on the table yet, and folks had already jumped to the conclusion is, ooh, race is not a problem. And yet the wealth gap, still 10-to-1. The income gap, the life expectancy gap, the greatest predictor of one's ability to break out of poverty is what was your parents' status in terms of socioeconomic capability. So the sensationalism that you raise is we cannot use this as an excuse to do a lot of frenzied kind of interaction and a whole lot of talking. If we're not going to do the work that pushes the metrics and we can then show data that says we've impacted in these areas, then what we're doing is we've just put a more polished face on an oppressive framework. And at the end of the day, that ain't worth a you know what.
Yes. So we could talk about this and should talk about this all day and into the next session and into the session after that. Let's discuss how white leaders can guard against what you're really describing as white fatigue, right? From where you sit, we threw around this phrase, authentic allyship, and there's links to material that are being shared with you right now. What does authentic allyship look like for whites and white leaders committed to addressing racial inequities within their respective institutions and communities?
Well, I think first it goes to the first piece. I'm not sure what white fatigue is and why there would be white fatigue. What are you tired of? Whiteness still has an exclusive value in this society. If you're tired of being privileged, first of all, that's a lie. But then if you really want to talk about fatigue, let's talk about 400 and now in the 401st year of the fatigue of being denied the dignity of humanity in real time. So part of it is you know, if we're gonna have these conversations, don't come hedging a bit like white folks are tired.
Yeah.
Tired of what? When you get up in the morning, I don't know too many white people that wonder what might happen to them if they have an arbitrary, unscripted encounter in certain places because they white.
Yep.
Right? Black people, we get profiled. You know, you got educated Black folks. We good Black folk on this panel with you today. And if we end up in the wrong space at the wrong time, none of those things that would otherwise give us some level of white acceptability is not going to benefit us in the process. So the first thing I would say is, if we're going to have real allies, don't come to the table talking about you tired. If you tired and you're still privileged, please sit down and stay out of the way. And let's get some folks who are really ready and energized to take advantage of the moment and do the work. Because I'm tired of hearing folks saying there's white fatigue. Are you kidding me? I'll tell you what, you want to have white fatigue, let's trade places. And I'll let you walk a little bit in the experience of a Black man in America. And I'll walk in the experience of the privilege that many of our white wannabe allies have. And let's spend a little time in those spaces and then come back to me and talk to me about fatigue. So if we're gonna have some real allies, don't come to the table with excuses. Come willing to put some risk on the table, get some skin in the game, and let's really move the dynamics to make equity and equality truly outcome driven and evidenced, not by what we say, but by what we do.
Yes. Yes, let's. And probably a different word than fatigue, that privilege of that some of us have, that I will acknowledge that I have, to not participate in the discussion if it makes me uncomfortable, right? And so that window shutting, that moment that we are in now, look, I don't have to think about it 24 hours a day, every day. So how do I deliberately, and how do we deliberately, when in that place of discomfort? You know, one might say it's human instinct. If you put your hand over a flame and it hurts and it's uncomfortable, you're going to pull it back. Some have the ability to do that. Some do not have the ability to do that. How do we keep our hands in the flame?
Well, first, understand the flame is hot.
Yeah,
it's been hot for a long time. Some of us have had to learn how to survive in the fire.
Right.
And so if all you're going to do is experience a short-term discomfort on the way to long-term progressive and structural change, then suck it up and let's get on with it. I think you pointed out in your own sense of, you know, sometimes feeling like you can withdraw. That by its very definition is a sign of privilege, because you can even consider withdrawing.
Yep.
Those who are oppressed cannot consider withdrawing from being oppressed. We've got to work through. You can't withdraw and say, I just choose not to be oppressed today. No, we got to change the structures and the systems that make oppression possible and make oppression acceptable, so that we can really get back to making sure that everybody has the option of what we will call agency to choose to engage without having to be forced to engage.
Yes. Let's turn to the questions here while we still have a little bit of time. Let's ask a question for you, County Executive Ball. This one comes from LaWanda Williams, Director of Housing Services at Healthcare for the Homeless. There's been a national conversation about reimagining what community-centered policing could be, as opposed to reforming the current system that historically has not served the needs of Black, Indigenous people of color. What are steps that government can take to create a system of policing that actually serves people and their interests.
We need to recognize the importance of community policing, need to engage the community. And I think that there needs to be communication from the top, me, the police chief, on down, that it's a priority. There is a lot of lip service that goes on. And as my good brother, the Reverend Dr. Yeary noted, having measurable outcomes, looking and saying, what can we do at the end of things and say, we did it? What does it really mean? Can we say that we had better interaction, that we broke down what we see is right now the numbers where Black and brown people are incarcerated at a much higher level? Black and brown children are expelled and suspended at a much higher level, disproportionate to how many and what percentage they are in the community. Can we look at those data at the end of it and say that we've made a difference? Can we then look at the qualitative data and talk to people who are impacted and say, do you feel more comfortable? Do you feel as though, as Dr. Yeary said, you are a little less anxious when you're around these groups of paramilitary people? And having those real conversations, I think that is very important and will lead to some of that systematic change that hopefully will be lasting.
Thank you. Thank you. Let's ask this next question to you, Ms. Woods. What can people that don't have power do to gain power?
Well, I think for persons that don't have power to gain power, that is, we have to first be able to tell ourselves, if I have a voice, I do have power. Now, that's easier said than done, but I also think that what we learn when we say, where do we go from here? And we've utilized Dr. King's speech during that time. But in the beginning of his speech, he talks about the progress that they have made over the 10 years. And the reason that they were able to make such progress that he points out in the speech is because of the galvanizing of persons coming together. And so coming together in community. And I think when we're talking about power, sometimes power is linked to monetary resources, but I would suggest that persons understand that your lived experience is your power, to understand that you are an expert in the place in which you sit, and you have to begin to own that. You have to begin to own your story and own when people are coming. And as Dr. Yeary said, when people are coming and thinking it would be tokenism, right? To say just because you come out to the community, it does not mean that that's a discount. What it means is that you're going to get quality and value add service. And so even if there are community health workers on the call and everything else like that, I think that you should begin to own your voice and then make a collective effort to build networks of persons that share in that sentiment, so you can amplify the voice, but also taking ownership, that not allowing anyone, it has to come from a place of inside. I always talk about doing this inside, going within and doing the work, and it's affirming yourself before anyone begins to affirm you. That's how you get the power. That's real power.
Thank you. Thank you. And thank you for the questions that came from the audience today. And thank you to each of our participants. One final question. If you could ask participants, everyone gathered here today, and we're more than 120 people here today, to do 3 tangible things to eliminate individual, institutional, and structural racism, what would they be? What would they be? County Executive Ball, why don't you kick us off?
I think that if I were to ask, as the conversation with you and Dr. Yeary about taking a break, so to speak, when there is fatigue, working through that challenge, because as Dr. Yeary said, there is no opportunity for that. If there is an attack, on a person of color, speak out. Speak out as an ally. It can't just be brown people coming to the defense of brown people. There needs to be a collective of good people saying what is unacceptable. Then advocating for, if we're going to talk about more investment in the things that will dismantle what we're seeing as such a negativity, and frankly, what COVID-19 has revealed in who's getting sick and dying, advocate for an investment in some of those issues surrounding comorbidities like diabetes, like high blood pressure, like hypertension, and making sure that we don't just say, wow, that's really sad. We say, let's put some more funding in those. And then finally, checking some of the microaggressions that while you may be well-meaning, you actually engage in, like, I don't see color, I'm not racist, I have a good Black friend, I hired this one Black person, checking that those are not helpful and that to people of color, those are actually harmful. I just want to recount one story. I was talking with someone who was actually a strong supporter, and after I'd given a speech, they gave what they thought was a high compliment in saying, you don't talk like a lot of the Black people who I know, you talk so much better. And recognizing that that was so offensive that a decade later, I'm still offended by it. If you can work on those three tangible things, you can help move the conversation, our country, and our goals forward.
Thank you. Ms. Randi Woods, three things participants could do, tangible things to eliminate individual, institutional, and structural racism.
As Calvin pointed out, using a person's voice. So I'm going to give three tangible things, and I'm going to suggest that persons on this call, because some persons have said it's hard to know what to say and things like that. I'm going to say that on August the 13th, Natalie Gilliard again will be offering a 90-minute crash course on just the facts, understanding and dismantling structural inequality. And so look her up on Instagram or go to her webpage, factuality.com, where you will be able to get a crash course on structural inequality in America. And then there is another Black brilliant young lady who is doing the work of trying to dismantle inequalities in our community, named Joyelle Arvella. And Joyelle, let me pull it up because I want to make sure I give persons facts here. Joyelle is going to be having a seminar called Ego Tripping, 28 Days of Unlearning Internal Biases. And then she also has a workshop going on called Racial Inequities, and learning how to lead, building an anti-oppressive facilitator practice. And so really talking about, for those persons who are holding positions, really learning more about anti-oppression. And then we can come back and ask that question, do you have blind spots? Because as a person who works in this field daily, I bump into my blind spots all the time. And so I'm going to say we create opportunities for everyone on the call to continue to ask yourself, how am I showing up and how am I creating space? And you can use these two platforms by Joyelle Arvella and Natalie Gilliard to help you to bump into yourself a bit more.
Excellent, thank you. And Reverend Dr. Todd Yeary, three things, if you could leave with participants to eliminate individual, institutional, and structural racism, what would they be?
Three things. First, commit to risk. Commit to risk. Don't come with I want to see how it starts and I'll decide if I stay. Come to the table ready to risk whatever is required to get to the results that you say you're supportive of. So that's one. Second thing is learn unsanitized US history. We find ourselves trapped in the mythic telling of that history that Frederick Douglass spent a lot of time talking about. One of the books, if I were to put something else on your reading list, The late jurist A. Leon Higginbotham wrote Shades of Freedom. You might want to get a copy of that, Shades of Freedom, and begin to kind of get beyond the, from the manifest destiny, sea to shining sea, kind of fairy tale of US history, because behind that is a violent telling that often gets left out. And so we get this sanitized notion where now you have the NFL proposing that the way we're going to work around it is we're going to sing the Negro national anthem before the national anthem of the country, and somehow or other that makes us woke and progressive. So that's problematic, so that we avoid being offensive to the importance that those are not parallel songs. They actually speak to opposite ends of the continuum of oppression and racism. So that's one. Second, learn and sanitize history. Third is don't caveat your engagement. Don't go in knowing that you're going to try to take the first escape route out when things get hot. That happens too many times in these discussions, that we come in pretending to be well-intended, but the first time it gets hot, we like, can't do it. And here's what we know. I can tell you this, if we're really going to deal with structural racism, it's going to get hot. It's going to get hot because we have to confront what has been the falsehood and the lie that has gotten us here, and really begin to wrestle with the dark truth. And there was a dark and ugly truth on that afternoon when George Floyd said several times, "I can't breathe." And in the denial of his humanity, the responses we just heard from the body camera was, well, then just be quiet. If we're going to deal with it, don't expect those who are simply trying to catch their breath stop telling us to be quiet simply because we want to get to the singing of Kumbaya without doing the work that will get us to Kumbaya.
Please join me in thanking the Reverend Dr. Todd Yeary, Randi Woods with STAR, and of course the Honorable Calvin Ball, County Executive of Howard County. This has been a challenging discussion. And the question here is, where do we go from here? As I mentioned at the top of this conversation and 2 weeks ago in part 1 of this first community of practice session, is that this is a community of practice. This isn't a webinar. This isn't intended or designed in any way to be a one-time event. So I leave you with the words of some of our participants here today. Do the work. How do we show up? What is our space and place in the dynamics of race, to use Eddie Martin's question? Do the homework. If you've not already done so, how do you work in your own organizations to create a comprehensive racial equity and inclusion framework at your institution? If you do not have the power to do so, to create such a framework, what are the changes that are within your control? How can you endeavor to be an authentic ally in the workplace with your own voices in your own actions? If I took off these glasses, I wouldn't be able to see absolutely anyone on this screen. How do I apply a racial equity lens? So that it's something that I depend on in order to see, and not something that I can choose to take off. If I choose to take off these glasses, I assure you I will not be alive much longer. How are you endeavoring, and how are you working with your organizations to see through a racial equity lens? Think concretely, think specifically. Look for our next community of practice invitation. I see in the chat box one of our board members, Athena, noting that she wants to talk about housing. Yes, we absolutely have to talk about housing. Recently, the governor committed $30 million for eviction prevention. Those of you that have been following this knows that $30 million is like sending a medic to a battlefield with a box of Band-Aids. The crisis that we are about to hit when the courts reopen and the eviction moratoria expire is going to produce a wave of homelessness disproportionately experienced by Black and brown people, the likes of which we've not seen since the Great Depression. What are we collectively going to do about that? The next session that you will receive an invitation in the coming weeks. We don't have a date for it yet, but it will be on housing inequities, race, and health. Housing inequities, race, and health, with a particular focus on eviction prevention advocacy. Immediately after this event today, a participant list will be distributed to all panelists. This is fundamental to our concept of a community of practice. We have to be able to communicate with each other outside of these particular sessions. If you would like to opt out, please notify communications@hchmd.org, right there, and we can make sure that we do not include your contact information. I strongly encourage you to opt in and have your information distributed to everyone involved in this community of practice. You will receive this afternoon an email with a survey. I encourage you to take that survey. These are really important. I think you can tell from the flow of today's conversation that we listened to your input after the last conversation about how to make this even better. So I encourage you to take that survey and to look for more information. And then finally, I would just like to thank our participants again for participating in this fireside chat and this exchange that we will continue. We asked you to put yourself right at the intersection of the personal and the professional, and each and every one of you did. And we all thank you for it. For more information about our community of practice, there's the web address on your screen. And thank you to all for leaning into this discussion, and we will all talk to you very soon.